Hello.
Hello, how are you doing?
I'm good. We did have a little problem. No, I think it's fixed right now.
Yes, right now I think we can start. We have already a lot of people waiting for us. So,
Okay.
yeah, so I will start our live stream here. First of all, hello everyone. I hope you can hear us. Is our voice clear to you guys?
Okay. I guess everybody can hear us.
Okay, great. So first, before we start with our hot topics, I want to remind everyone about the following week. On the weekend, 20th and 21st of July, we will be visiting with Dr. Ersin, the UK, London. So if you want to make up an appointment, please DM us or just text us via the WhatsApp number on our profiles so we can make up an appointment for you to see him face to face in London. So please don't forget about this. And I will go on with our first topics if we are ready.
Okay.
So we will start first, of course, with the most asked questions, the frequently asked questions, which are about the liposuction and safe BBL. So first of all, one of the most surgeries you are doing is 360 lipo and safe BBL. Can you give us some examples? What is the difference between traditional BBL and your technique safe BBL?
So, and recently we are using very high technology and the new generation surgical techniques are allowing us to do much more aggressive liposuction than before with safer ways. So we are keeping the patients away from any kind of possible complications like excessive bleeding or infection or some kind of imbalance about the body and electrolytes and any kind of blood clot problem. It's not only about the BBL, the safety. We need to keeping safe all the patients against any kind of complication about the surgery. So it's not only safe BBL, it's about the safe surgery. We need to keep the patients away from it. So for that reason, the first step for the health tourism patients is the detailed medical history. Firstly, we need to take this with no, missing information. And if we find out any kind of obstacle, any kind of risks, so we need to inform the patients. And if there are obstacles, so we cannot go through with any kind of operation. That's the first step. The second step is the patient evaluation with good pictures. Sometimes we need videos, if possible, with a face-to-face consultation. So next week we will be able to do it with abroad patients also in London, and we need to make a real and 100% good indication to have a good result with no problem into the surgery and after. And right into the surgery, we are taking a lot of precautions for the blood clot, infection, or bleeding, or skin blood circulation problem, any kind of complication. And after the operation also, we are taking care of our patients every single day in the hospital and in our aftercare hotel as well, to keep them in safe. And we are teaching how they will take care of themselves in long term, especially once they are back in their countries. But when they go back to their countries, we are not, we are keeping the contact with them, and we need to follow up them with whole process till full recovery time.
That's also one of the most asked questions. What happens when I'm back in my country? We are not leaving you. We will be following up. Our aftercare team will be contacting you. They will send their details to Dr. Ersin, so he will also be directly checking up on you, even if you are back in your country. And while you
Yeah.
are here, we have our hotel where you have daily nurse visits, so you will never feel alone, and you will have always someone who is doing the medical treatment for you. So don't worry about that. Dr. Ersin, while you mentioned about the medical history about the patient, that's also one of the frequently asked questions. Some patients, they are applying to us with fillers, like chemical fillers in their bum, and you are rejecting them. May you explain the reason why, so it can be clear for patients with filler on their bums?
So it's about the safety again, because this kind of fillers are not yet very, in safe side. So these fillers usually are causing some kind of serious complications, like infection, like damage into the subcutaneous tissues, like fat tissue and muscle tissue, and sometimes on the skin as well. So this effect is not going away, never. Once you do this filler injection, you might have this risk, right? Recently after the application, and this risk is not going, away, never. After a couple of years, also, if you have any kind of surgery in this body part, especially on the bum region, you might have the same complication, because sometimes the infections are getting like sleeping infections, latent infections. So in any kind of surgery, you might make it wake up again, and it might give you a very spread away and serious infection, like a life-threatening infection. So for that reason, we are not operating on this kind of patients, and we highly recommend to keep away from that kind of body fillers, especially on the bum region. It's completely dangerous.
Here, I want to mention also an important point. You are not only avoiding to do BBL to these kind of patients, you are also avoiding to do only liposuction, especially close to the area, since it's also the same procedure that can wake up the infection areas there, right?
Yeah, that's right, because the BBL surgery on these patients are highly risky for the infection, but the only liposuction procedure has the same effect, and to make the latent infection get active and become a life-threatening complication. So for that reason, the risk is all the time higher than the other patients.
Great. I think that was a clearly explanation to everyone who has like a question mark in their heads. So I saw a question downstairs directly about this. Someone was asking, we were talking about fillers, that you are not accepting surgeries for people with fillers. Can you quickly give also some illnesses or sicknesses which you are not accepting for surgeries? Like what kind of patients you are totally not accepting?
Yeah, this kind of operations are not a must. It's some kind of, and these indications are on our patients' requests, and our aim is to make them more comfortable and more confident with their lives. So for that reason, we need to do this kind of operations under, optimal health conditions. So, because of the liposuction procedure is making damage for all kind of subcutaneous tissues, like the nose, vessels, blood vessels, and the skin itself, we need to think about the skin blood circulation after the operation also, and the healing process should be in optimal circumstances also. So if the patient has any kind of predisposition for blood circulation problem or infection, so we need to not to do any operation for this kind of patients. And the biggest risk about the infection is the diabetes disease. So if the patient has diabetes, even it's under control, the risk, the serious infection risk is higher than usual. So for that reason, we never do body shaping operations for patients with diabetes. And the other thing is about the blood circulation or, serious bleeding problem. So if the patient has any kind of blood, disease like sickle cell disease or trait, or any kind of, anemia. So we need to keep away from this kind of surgeries. If they have anemia, we need to find out the reason and fix it, and then we can do the operation for them.
For these kind of patients, we are mostly also asking for blood tests before coming, so we can see their results and accept them or like reject them before they are coming and spending all of money for their tickets, etc. So in these cases, just contact us. Our team will help you with like guiding you if you are if you are okay for a surgery or not. So just you can ask us. We will help you with all the questions in your mind. So I will change to our next topic. So that's also one of the most asked questions. So mostly people, like our patients, are asking for their tummies for a tummy tuck. Some patients are okay for a tummy tuck surgery, but some don't need it. So we have also mini tummy tuck and the standard full tummy tuck. And there is also like third way of like tightening the skin there, which is the J plasma. Can you tell us about the tummy tuck and the J plasma? Which kind of patients need the tummy tuck? Which kind of patients need J plasma? Because mostly patients, they don't want the scar and they think they are okay to have the J plasma and it will fix their problems. So I want you to tell us in detail about these treatments.
So thanks for this question. And basically, we can make for the tummy reshaping. We can think like at three groups of patients. The first is the patients without a lot of sagging or excess skin on the tummy, with a good quality of the skin. So for these patients, we don't need any kind of skin tightening treatment, or we don't need any kind of skin lifting procedures. So after the liposuction, the skin is making a tightening reaction for after any kind of surgery in any patient. And if the skin quality is good and elasticity is good, and if the patient doesn't have skin excess, so after the operation in this patient, the skin tightening is being in good way, so they don't need any kind of support about the skin tightening. The third group, that was the first group. The third group is the patients with a lot of skin sagging or skin excess patients, and usually this kind of patients has history of one or more childbirth or massive weight loss history with stomach surgery or diet or anything else. And if the skin is too loose, in bad quality, and with a sagging part, especially below the belly button. So only liposuction will not help for them. The J plasma usually is not being enough. So for this patient, the best choice is a tummy tuck surgery with liposuction. The liposuction is making the waistline slimmer, body slimmer, and the tummy tuck surgery is getting rid of all the sagging tissues. And the other group is the number two. This patient doesn't have a good skin quality. The skin is loose, but they don't have a lot of sagging also. This is the moderate group. So in this group, only liposuction might not make a good skin tightening reaction, but they are not a candidate for a tuck surgery also. So these patients are the best indication for a J plasma, and the J plasma is a machine which is an energy-based machine, and the energy is based from helium plasma and the radio frequency, and it's superior to any kind of machine as well. And the biggest advantage is just a single use machine. You don't need to use it like different sessions in long term, and it's applied right into the surgery after the liposuction procedure, and the patient is feeling nothing about it, and the aftercare is the same with no additional complication risk.
Mhm. Yeah, I can see already people asking if they are like, if they have a condition, if it's okay to, if they can have the surgery or not. You can directly DM us, or like I said before, please contact us via the WhatsApp number written on our bios, on our profile. You can also contact Dr. Ersin's Instagram page or directly ours via DM. Our team will directly guide you and help you if you are suitable for surgery or not. We will be asking you for some medical questions and some pictures. Afterwards, if you want to go with Dr. Ersin, we will be sharing with him your medical history and your pictures, and he will check for everything if you are okay for a surgery or not. So please directly contact us for these kind of questions. So I will go on with our next topic here. That's also one of the most asked questions, since we talked about 300 Lipo, about BBL, about tummy tuck. There is surgery which is combined with all of them, which is the mummy makeover surgery.
Yeah.
Especially for patients who gave birth for one or more children. So can you give us some details about mummy makeover surgeries? And can you also tell us, sometimes patients don't want to have all surgeries at once. They want them to divide into two because they think they can feel really bad after the surgery. But some are directly want having all them together, so they can have it done in once, and they want to not to have a second session. What do you think about this? Do you think people should have all the surgeries combined together or separate them into two?
So, the mommy makeover name is originated from pregnancy, actually. So, the pregnancy is making some kind of differences and deformities on the body, especially on the tummy and trunk, waistline, upper and lower back, and on the boobs as well. So usually the skin is being too much stretched, and it has stretch marks and deformities and sagging, and the quality is getting worse. And on the boob, because of the pregnancy and the breastfeeding itself, the boobs are getting loosened and sag after the operation. Sometimes they are deflating and need some volume, or in some patients they are being too big and saggy. that which may make some kind of physical problems with the cosmetic problems like shoulder pain, neck pain or back pain or something like that, and some kind of skin diseases also. So, Mummy Makeover is an combined procedure for all the trunk as one unit with the boobs, with the tummy, and with the back, and with the bum also. So, in most of the patient has some kind of deformities, especially on the side part of the bum, which are called hip dips. And with an fat injection procedure, our first target area is all the time the hip dips, and it's the most challenging area also in most of the patients. And with Mummy Makeover, we have some kind of steps. The first step is the 360 lipo to make the trunk as slim as possible and collect the fat, put the fat into the bum to make it more round shape and more proportional for the body. And the third step is the tuck surgery, which is making the skin, the excess skin gone and repair the muscles, especially on the midline of the abdomen. And the other step is the breast surgery. The breast surgery depends on the patient's needs. In some patients, just lifting isn't being enough. Some patients, we need to do a reduction with a lifting surgery. In some patients, we need to give more volume with implant or fat injection, like a supporter for a lifting surgery. And this combination can be done in just one session as long as the operation time is not being too long. And in our hands, this operation is taking around 5 to 6 hours, and the 6 hours pure operation time is the upper limit for us. If the operation will take more than 6 hours, so it's better to separate them to keep the patient in safer conditions.
So it's about the time, because during the operation time they will get the anesthesia, so we need to hold it like shorter for their safety.
Yeah.
So you mentioned also about breast surgeries. That would be my next question. Here about the breast surgeries, like you are performing breast lift, breast reduction, breast implant, or you are combining some of these surgeries together. One of the asked questions here is patients, sometimes patients are applying and they already have implants in their breast, but sometimes patients directly want a normal implant for an increased size. So some patients are asking, how long do it take to change my implants, or do I have to change my implants in time after the surgery?
Yeah, in past times, in old generation implants, that was like a recommendation after any kind of implant surgery. Usually, we did recommend to change the implants like every 10 years. But nowadays, the new generation implant doesn't need to, replacement or change them again, as long as you don't have any problem with them. So after the implant surgery, it's highly recommended to make a check with physical examination and scan also, like ultrasound or MRI, to check them like every year and make sure they don't have any kind of problem with them. As long as there is no problem, so you can keep on using them for like a lifetime. You don't need to change them anymore. But the biggest concern or problem or reason to replace the implants are, deformities on the boobs because of the aging and gravity also. And the second thing is the capsular contracture. The implants are very compatible to the body, but even they are compatible, somebody is making some kind of reactions to the implants, and the body is feeling the implants like an foreign body to the body itself. So in order to keep itself in safer place. It's trying to create a capsule around the implant, like an envelope. And this envelope usually is being very soft and thin, which is the natural reaction. But in some patients, this natural reaction is being more exaggerated, and this thin and soft envelope is being thicker, harder, and making deformities to the boobs, sometimes with pain. With that cases, we need to remove the implants with the capsule around them, like an in block resection, and reshape the breast again, and change the implants and follow up the new implants after that.
So if there is no issue, the new generation implants, they don't have to be changed. They can use it lifetime.
Yeah, it doesn't need to change them. Just they need to be followed up and like an annually checkup. That's all.
So that will be enough. So I saw some question about our current topics. Before moving further, I want to check on them and answer them, since some of them, they are important. There was one question about the tummy tuck here. Do you do also muscle repair during the tummy tuck? That's the first question. And the second one is about the belly button. Sometimes after the 360 lipo or the tummy tuck, the belly button can change or not, depending on the saggy skin. Depending on what you in place. That's the second question here.
So, in most patients after pregnancies and childbirth, usually the muscles are separated on the midline, so it needs to be repaired. It's a must after this kind of surgeries to make the tummy flatter. But in massive weight loss patients, like gastric sleeve or with strict diet, usually in these patients the muscles are not separated, because once they are losing the weight, mostly it's loosened from under the skin and from intra-abdominal area, which is called visceral area, and this muscles are tightening also in long term. But if they have any kind of looseness or separation on the midline, we need to do a repairment also. And almost in all tummy tuck patients, the belly button is very, deformed before the surgery. And after the surgery, we are making it much natural and pretty and more reshaped and, much more better. So after the operation, for sure, it will be more natural and much better than before.
So I think that was a clear explanation also for the questions. Let me check. There were also some questions. I can see still some questions about details. Please feel free to contact us via the DM or the WhatsApp number, so we can help you further with the questions. Okay, I think these were the questions for now. I will go further with our topics. You can write your questions down, so we will be answering as far as we can see them. So the next question here is mostly, of course, women, they want always sometimes have bigger breasts or do the reduction or reshape it, especially after giving birth or breastfeeding. But we have also some males who want to get removed from the saggy breast looking, since there is too much fat tissue or too many glands inside, according their diets or genetic issues here. Can you give also some details about the gynecomastia surgery? There are two types of them. One is the standard one done with liposuction, and the other one is the surgical one. How do you decide which one should be done? Can you also give details about that?
Yeah, big breast in men has a couple of features than the woman. It's completely different than the woman, and we need to remove almost all the gland, sagging skin, and the fat tissue from underneath of the skin. The first step is the liposuction in every single patient, and we need to remove the fat from underneath, like almost all of it. And any kind of liposuction procedure cannot remove the gland because the gland tissue is more, harder and resistant to remove it, and we need to remove it by surgical way. So after fat removal with liposuction, the rest of the tissue is all the time the gland tissue, and we need to remove it surgically. And if the patient has sagging tissues or lots of skin excess, in this patient we need to remove the skin also. It depends on the level of the deformity. The first step is the lipo, the second is surgical gland removal, the third is the skin removal and lifting surgery.
So, okay, I think that will also help, especially our male patients, to understand if they're applying or want their change. I will move forward to the next topic, which is also one of the most asked questions, like one of the frequently asked questions. So, you are especially known for your procedure, liposuction, tummy tuck, etc. But we know that you are also performing genital aesthetic surgeries, which are not really taught a lot. So that's why mostly our patients don't know exactly what kind of procedures you are doing. Can you give us example what kind of genital aesthetic procedures you are doing, and can you also give some details about their methods and according what kind of patients can apply for them?
Yeah, that's very, important part because it's, maybe the most underrated problem in women, especially after natural childbirth. But this kind of deformities might be like from birth or because of any kind of trauma also after the, after any kind of trauma. It might be like a surgical trauma or any kind of trauma. So it depends the patient's needs. Usually, after the childbirth, natural childbirth, the vaginal orifice is being, damaged and with bad cosmetical outcomes and whiteness also, orifice whiteness, which is making the sexual pleasure less than usual. And usually patients, hesitating to tell this kind of things to us, but these procedures, especially the vaginoplasty procedure, should be a part of mommy makeover surgery. And we are asking the patients with, natural birth history if they have any problem with the genital area, and if any kind of deformities existing on the genital area, we are fixing it into the same operation also. And this operation, the vaginoplasty operation, is making the orifice tighter. It's like a vaginal tightening operation also. We are repairing the muscles, the pelvic muscles, and the aesthetical, appearance is being much better because before the operation, usually, once you look at the, genital area, you might see the vaginal mucosa also, which should not be seen with this kind of examination, but the patient doesn't think it's a problem for them, or they might not. It's not easy to tell this to anybody, so for that reason we are asking them, and if they have any problem with here, so we are fixing this problem also. And the most frequent congenital problem is the hypertrophied minor labias. So with these patients also, they might have some kind of problem to find a bikini or protrusion on the genital area. So with reduction of the labias, this problem is being gone. In some patients, the pubic area might be a problem, a very big or protruded pubis. The liposuction procedure is a solution for this. And for the major labias, usually the problem might be hypertrophy or small and atrophic labias. So if the bigger outer labias are too much atrophic, we need to fix it with a fat injection. And if they are too big, we might need to reduce the fat underneath with a skin removal.
So mostly, especially our patients who gave naturally birth, like you said, or even standard patients who have different traumas there, like you also mentioned, women, they mostly think it's not a problem, or they can feel the change after the surgery. So mostly a lot of people need this, especially a lot of women need this surgery, but they don't recognize it until it's like someone or a doctor tells them that they need it to be changed. So they think it's normal. So especially our patients, feel free when you're here to ask questions about this. So Dr. Ersin, he will help you further with that. So we are, like we said, we can do liposuction to the pubis area if you think it's too thick. That can help to tighten the area. We are doing fat injections. We are doing the labioplasty or the vaginoplasty, which is tightening. So these are the procedures you are doing as genital aesthetics, as you mentioned. So I will go further with the next question here with our next topics. So since we talked about different kind of surgeries, there are also patients, for example, some of our patients, they are for body shaping surgery, but they want also their teeth done, or especially for the male patients, they want also hair transplantation done, but also have an gynecomastia. There are a lot of mixed procedures, or for example, when patients are coming for the double chin liposuction, they are asking if they can have also the medical procedure done, which is the filler to their faces. There are a lot of different kind of mixed things here. So do you prefer people to come for these kind of mixed surgeries? If yes, which one do you prefer to be the first one and then the second one, and how long should, how many days, how many weeks should be in between these two procedures?
Yeah, Turkey is one of the biggest medical health tourism center in the world. So the patients usually might have different problems that needs to be fixed, like especially on male patients, the baldness or any kind of dental problems, or any kind of medical aesthetic issues also. So the patients can fix all these things with body shaping procedures in just one medical journey. And for example, if they need an hair transplant, we are making the hair transplant all the time firstly, and after a couple of days we are making the other surgeries, the body shaping, rhinoplasty, or any kind of face procedures, boob job or tummy tuck, it doesn't matter. And we are planning all kind of dental treatments also in the same medical journey, and it might be like a couple of states usually with the dental treatments, so we can arrange the schedule accordingly to the other aesthetical surgeries. And the medical aesthetic procedures also for the face or the other body parts, the fillers, Botox, or any kind of rejuvenation can be done in the same medical journey. So we need to make an evaluation for every individuals because every case has its own, features also. So we need to make, like a tailor-made plan for every single patient.
So there can be also done a lot of mixed procedures and only one journey. If you want to know if you are suitable for these kind of mixed procedures in one journey, just feel free to text us. Our medical team is always ready to answer you with all your questions. So before switching the topic, I will check one more time about the questions. We have some questions again. So here is a patient question down in the comments. Here, sometimes people they are doing the 360 lipo and the BBL at the same surgery, but sometimes patients they are asking if only the 360 liposuction is enough to have a good waistline and also a nice looking bum. Do you think some patients are okay for the 360 liposuction without a BBL for a good looking projection?
Yeah. In most patients, there might be a misunderstanding about the BBS surgery. It's thought like a butt enhancing procedure, just this. So our aim is not only make the volume more than before the surgery. First priority should be reshaping it with more natural way. So the liposuction procedure is the main course of the surgery, and you can have the biggest part of the achievable result with only liposuction procedure, like about up to maybe 80% of the result usually. But the fat injection to the bum is like a supporter, like a side dish of the main course. So it's making it more delicious and in better proportion, and you can have the rest of the 20% of the achievable result with a fat injection to the bum. And the liposuction procedure is more trustable than the fat injection, again, because once you remove the fat from the body, as long as you don't gain weight, you will never see it again on your body. So it's 100% guarantee. But the fat injection is done with a live fat cells. We are removing the fat from the trunk or the other parts of the body, and then put them on the recipient area. So once you put it in any part of your body, and we are trying to keep this alive cells into these areas, as much as survived. So, but even you take all the precautions, you cannot survive all the injected fat on the bum or face or the boobs. It doesn't matter. So the fat injection is less trustable than the liposuction. The liposuction is, a stronger weapon for us, but the fat injection is a supporter for sure. And to reshape the bum, especially the hip dips also, the fat injection is the only way, only safe way for us. So why we have a good amount of fat because of the liposuction, so why not? It's very, makes sense to use it for the bum to reshape it. Even it's not as trustable as like a liposuction procedure.
So while we were talking about fat injection, I can see a question here in the comments. Do you do also fat injection on face? And are there different areas you are doing the fat injection? Can you also give some details about that?
Yeah, the fat injection is making a good volume, wellness, and rejuvenation on the injected areas. It doesn't matter the place, the region. So in the face area, usually the injection areas are the forehead. Sometimes in some patients, the forehead is being too flat, especially on women. Flat forehead is making them more masculine. So a curvy forehead is making the appearance more feminine. Other than this, the temporal area, lower eyelids, or the nasolabial groove, or the marionette lines. Sometimes the jawline is needed to be, fat injection to make it better, or the cheekbone, especially, is the biggest part of the volume. Sometimes in some patients, we are using the fat injection from up to down on the face, sometimes on the boobs, like just one procedure, just for enhancement. Sometimes it's a supporter for lifting surgery to make the upper pole more, prominent, and make the cleavage better. Or if the patient has any kind of deformity on the body because of previous, trauma, or any kind of surgery, sometimes the fat injection is improving the result, and with the stem cells, especially, it's improving the skin quality as well. And the bump is the most and biggest the donor area in some patients, especially male patients. It can be used for penile enlargement, not for it's for the thickness, not for the length. And in women also, we might use it like a supporter on the labial region to make it, more puffy also. And it's more rarely, but in some patients, especially on the dorsum of the hands, the fat injection might improve the rejuvenation, and it might make it, more younger, the dorsum of the hand, and the calf area as well. I guess is the last area I can mention about. In some patients, the calf area is too much skinny and thin. So in this kind of patients, the fat injection might be helpful to make it more proportional with the upper leg.
So the fat injected, like harvested fat from the liposuction, can mostly used in a lot of areas, like you mentioned. And we have directly a question down here, and it is written: can face fat transfer be done together in one session with 360 lipo and BBL? May you can answer it directly right now.
Yeah, for sure. Why not? We can do it.
So while we were talking about face, I know that you are also doing some face procedures. You are of course mostly known for body shaping ones, but let's talk also about the face procedures you are doing. So because mostly the patients, when they are coming or when we are having a deep talk to them, they are not asking for that because they are thinking you are only doing body shaping surgeries. Like I know that you are doing like the prominent ear surgery, you are doing double chin liposuction in knee, you are doing upper and lower eyelid surgeries, and like you mentioned, fat injection to face. And is there anything else you are doing, or give examples about the face surgery you are doing?
Yeah, on the face area, mainly the operations that I'm not performing is the nose job and the facelifting procedures. But other than this, the upper and lower eyelid surgeries and the autoplasty or the lip lift procedures and double chin is pretty much frequent, especially, and the fat injection to face are like an, a part of our combined surgeries. Usually the patient doesn't asking for like a unique one operation for the eyelid or the face procedures, but generally it's like an additional procedure with the body shaping surgeries for us.
Yes.
And I'm performing it, pretty much.
And since these are really short procedures that can be done directly combined with the body shaping surgeries. So just now I think the patients are more clear about the questions if you are performing face surgeries. Yes, like we mentioned right now, we are, like Dr. Ersin is performing these kind of surgeries. Just checking for a few more questions here I saw. Just give me a second.
Okay.
So there's another question about the lipodema, especially patients who have lipodema on their legs. Do you think they are like suitable for a liposuction surgery, or would liposuction help to fix their problem?
Yeah, we need to, evaluate every single patient on each case differently. In some patients, the liposuction might have for the lipedema, and the lipedema usually it's a problem for the lower extremities with thickened subcutaneous tissue and hardened, and they might have some kind of lumps underneath of the skin which are painful, and some kind of aesthetical problems also. And if this patient doesn't have a lot of sagging skin with the thickened subcutaneous fat tissue or hard lumps, or resistant fat tissue, especially on the lower extremities, liposuction might be a solution for them. But if they have skin excess or sagging also, we need to discuss about the lifting procedures as well.
So it depends on the case and on the patient, on the medical history, etc. It has a lot of points, so we need to check before deciding if they are available or if it will fix their problem. So yeah, so in this case, you need to come to us so we can do like online the consultation with your medical history and clear pictures, so Dr. Ersin can check and evaluate your case here. So before coming to our last topic, I want to first mention about how the process is going on here when you're in Turkey. And afterwards, I will ask you, Dr. Ersin, about the recovery process for some of the most asked treatments here when they are back in their country. So first, I want to start with our journey, how our journey starts and how everything will go further until you go back to your country. So first, when we have a medical consultant team. They will help you with asking some medical questions and pictures to forward them to Dr. Ersin, so he can evaluate your case in detail, and he will check and give you like his recommendations and what he's suggesting if you need it or not. So you can share with us exactly what your problem is, what do you want to fix, and what kind of things do you want to change. Otherwise, Dr. Ersin will add also his own suggestions if you need something here. So the next part will be after having all the talks done, and if you agree to come for a surgery here, you will directly coming here, you will book your flight ticket, all the rest is included into our package here. After you arrive here, we will be picking you up, and you will have a translator here who will be following up with your procedure while you are going to this surgery, when you are going to your tests, to your checkup days. You will have always someone following up with you and being like physically with you and doing the translation in your language. Need so. The first day when you arrive, you will have your preoperative tests in the hospital. Your assistant will guide you there, and then you will go back to your hotel and rest. Afterwards, in the morning, you will meet Dr. Ersin in the hospital, and you will see him face to face. In case you want to, you have really details and deep questions, we can also help you with doing an appointment for a video call with him if you have deeply questions here. Later on in the surgery morning, like I said, you will meet Dr. Ersin there. You will have the face-to-face consultation. He will do all the markings. He will talk to you. He will listen to all your questions. After everything is done, you will go downstairs to your surgery. After the surgery, depending on the treatments you are having, you will be staying for 1 night or 2 nights at our A+ fully fledged hospital. You will have the nurses there, like 24/7 being there for you. And like after the surgery, Dr. Ersin will also visit you in the morning if everything is okay, like the next morning, if everything is fine. If you have any questions, he will help you out with there. His nurses will also be with you. Later on, when you discharge, again, there will be a translator and an assistant with you. They will be helping you, like picking up your stuff and also checking in back to your hotel. After the, again, depending on the treatments, after a few days, there will be a checkup. Dr. Ersin's nurses will do your massage. Depending on the treatment, they will give you some medical stuff you need for your aftercare, and they will also show you how to do your self-massage, your self-care, how you need to clean up all your body and the treatment places you have done. Later on, when you will have a day back in the hotel. While you are staying at our hotel, you will have also a nurse visit every evening. There will be also Dr. Ersin's nurses coming and visiting you after your discharge from the hospital. So they will check up on you, and our evening nurses are every day there. They will check up twice on you. They will help you showering. They will help you giving you a medical need. And they are always in contact with Dr. Ersin. So in case there's something we need to know, he will be able to know exactly what your case is there. So he can directly help further if there is any need in case. So you will have always medical stuff like next to you, close to you. You will be talking to your coordinator, your medical consultant in case you need anything. They will be helping you. So mostly patients are also asking, what happens if I'm coming alone? Do I be able to stay there, or do I need any help? So we have a lot of patients who are coming here. They are coming alone. They have here a translator and assistant while they're going to the hospital. Dr. Ersin's nurse are visiting you at the hotel. We have also 24/7 a nurse at the hotel staying for any emergency case. So you have always someone there for you in case there is any emergency. So the evening nurses, they are visiting you. Your coordinator will be here for you. So even a lot of patients are coming alone. They are not feeling alone. We are always here and available for you. In case you are coming with someone into our package, you can add someone like a +1 included without paying any extra. So you can come with someone which is also then covered with our package. So when you are going back to your country, which is the most like concern of the patients here, what happens when you are back in your country? How are we following up for you? Depending again on the treatment, we are like, you will have our aftercare team. They will contact you, and you will have also your coordinator always here for you, where you can directly text. They are always in contact with Dr. Ersin, so they will be sharing your pictures and your concerns, your questions to him, and he will evaluate, and then the team will exactly suggest you what to do, how to do it. We will share also with you some documents where you can see like how long does it take to go back to your normal life, when you can go back to the gym or starting doing some training, when you can lift something. So we will be checking up for you in the first week, first month, third month, 6 months, and after 1 year. But this will be the checkup times which we are sending you the questions and asking you for pictures. But otherwise, you will be free to text us whenever you want in any case, so we can help you further with your questions. So, Dr. Ersin, my to US, which is also a frequently asked questions. Patients also today asked here down in the comments, when can I go back to work? When can I go back to the normal life? And when can I start doing training, or I can go back to the gym?
So it depends on what kind of procedure you would have and what kind of occupation you have. Usually, after the body shaping surgeries, the time to go back to work is about 2 weeks' time, more or less. With a tummy tuck surgery, it might be 3 weeks, more or less. But if you have an, office job, so it might be less than this time. And after the operation, immediately you will start to move around and we will support you. And early mobilization, especially, will protect you from any kind of serious complication like blood clot, something. So every single day, your movements will be more. In the first week of the surgery, it will be possible to make light exercises like walking, and the patients are being, improve the exercise capacity like step by step till the first month of the surgery. And after the first month, usually most of the patients are being able to do more heavier exercises, but the exception is the fat injection to the bump. So the excessive exercises might make the fat survival less. So for that reason, with fat injection, patient we recommend to not to do too much heavy exercises for about up to 3 months time, but otherwise they can do any kind of their stuff and all the self-care by themselves.
There's one question here. It's like asking, is self-massage enough, or do we need some professional helping back home? Do you prefer them to have a professional massage when they're back home?
Yeah, self massages are a must after the surgery and easy to perform to themselves, and we are showing them how they would do it. But the professional massages are highly recommended, like every 3 days for the first month, about 10 times in the first month, and after the first month checkup we are making an evaluation and discuss what they need to do after that. Sometimes in some patients that just self massages being enough, we might need to recommend some kind of professional massages after the first one in some kind of special cases.
So if the self-massage is done daily, like you said, it's a must, but you will also recommending to have some professional massagers after, especially a 360 liposuction, as I can understand here. So I can see some questions here. It's about the embolism. How high is the risk of fat embolism? We have also a lot of questions because you are known for your natural BBL results, but sometimes are asking for an extra higher amount of fat into their bum. But I know sometimes you are like doing your best with giving the highest amount of fat the skin is allowing, but sometimes you need to stop at one point. So can you also explain this part of it?
So in my hands, the rate is still zero. We have never experienced this kind of problem with any kind of patient, and the fat embolism cases are completely correlated with the fat injection to the butt muscles. So if you make sure to not to put any fat into the muscle, so you can protect the patients from the fat embolism, because all the big and fragile vessels are just localized into the gluteal muscles. So we are putting all the fat into the fat tissue between the skin and the muscle. No fat into the muscle, and we are making pretty sure about to put all the fat into there. and we are confirming it and using the ultrasound guided technologies and the expansion vibration lipofilling technique. And with this technique, it's not possible to put any fat into the muscle, and with that way, we keep the patients in safer side with no fat injection to the muscle. So we have never experienced it, and it's not only about me. There are different a lot of surgeons who are using the same technique like me, and none of them has any kind of case report about the fat embolism.
There is also directly a question I can see is about the fibrosis. Is there a high risk of fibrosis if we want to fat adults?
So there is a misunderstanding about the fibrosis also. The fibrosis and scarring is a natural reaction of the body to any kind of surgery. But exaggerated fibrosis and or hard scars which are making differences or deformities on the skin is an unwanted thing. And with the too much higher energies, like more than if you use the energy based the machines more than enough, so the risk is getting higher. If you don't remove the fat more homogeneously, the deformities, irregularities, or bad scarring or bad fibrosis risk is getting higher, and the most important one of the most important way to get away from this kind of problems are regular lymphatic drainage massages and self massages after the operation. That's why I did tell you that the self massages are like a must after the surgery, because it's making the fibrosis in better way. The fibrosis is a good thing, by the way. It's making the skin tightening more. It's making the skin more resistant also, and we need to make it under control fibrosis, not to let it go away by itself. So with this kind of treatments and aftercare, we can make the fibrosis less with more skin tightening effect of it.
So yeah, I think that was a really clear explanation, especially for the question down. So I think we are like mostly spent approximately 1 hour. So I will
Yeah.
ask a last question here. I saw here in the comments, there was a question about the liposuction. So I know I want to give the information directly that you are not only performing 360 liposuction, there are also some areas, like additional areas you are performing, which is the chin, the arm, and the inner thigh liposuction. So the question here was like how many incisions are you doing during the liposuction? Because the scar there, mostly people are
Yeah.
they want less scars. So can you give the examples about the incisions for the liposuction areas?
Yeah, our aim is to reach, more region with less incision. So for that reason, we are trying to hide all the incisions in the hidden areas, like behind the bikini line, like brow line or armpits, or infragluteal crisis. So with that way, all these scars are being more invisible also. So for example, for the front part of the trunk, I'm putting the incisions on the groin area, two of them, one on the belly button, and two around the hip bones, and that's all. If the patient want an armpit lipo, so I may need to put an additional incision for the armpits also. And for the back part of the trunk, The one incision will be on the midline of the lowest part of the back, and one on the midline of the brow line to reach till the upper part of the back also, and two on the side lateral side of the hip bone area. And if the patient needs an BBL surgery for fat injection, we need to put on the infragluteal crisis also, just one incision for each. And we can do the inner thigh liposuction with these incisions also.
So for the arm, is there also only one incision, and for the double chin?
For the double chin, it's just one incision on the midline, but I'm performing the liposuction for the middle and side part of the chin also, for both side and for the middle, with just one incision on the midline. On the arm region, there are two incisions. One is on the elbow, and one is on the armpit. That's all.
Okay, so yeah, I think that was also clear. Just I want to also inform, since we talked today about the J plasma, and one of the questions is mostly where can you perform J plasma? J plasma can only perform to areas where the liposuction is done. Otherwise, there cannot be performed J plasma, since the same incisions and holes at areas are informed our patients also about these kind of details. So I think it is enough for today. I will check one more time the questions if there is something important. So yeah, I think that was it for today. I think there will be a lot of questions. Maybe we missed all of them. If you have more questions, our medical consultants are always ready to answer. You can DM us via Instagram or the WhatsApp number on our profile. Our team will help you. There was one question also about the languages. We have different languages inside, so we will be helping you we will try to help you in your mother language, and even when you're here, the translators will be there with your mother language to help you further to feel comfortable. I hope this live stream was helpful, and we tried to answer all your questions. I'm Lina from ClinicWise, and that was Dr. Ersin. I hope to see you in London again, especially for the patients who will be there next weekend. On the 20th and 21st of July, we will be there with Dr. Ersin. And if you want to do your appointment, please contact us. Your consultant will help you set up an appointment for you. Is there anything else you want to share, Dr. Ersin, with us?
No, it was my pleasure to meet with everybody here, and thank you also for good moderation. And I'm happy to being here, and I will looking forward for all of you guys next week.
So thank you for your time, and I wish everyone a great day. Bye bye.
Thank you. Bye bye.